College students, you're young, you're busy doing schoolwork, networking, living life with your friends. Are you staying up late to finish assignments? Spent all day inside studying without breaks? Having late night fast food runs? Have you touched grass today? You're at higher risk for heart disease than you think. Contrary to popular belief, heart disease doesn't affect only older people. College students are just as susceptible to heart disease as any other age group. Heart disease is an umbrella term used for conditions that affect the heart structure and function. Some heart diseases include hypertension, heart attacks, heart failure, arrhythmia, and coronary artery disease.
Did you know that heart disease is the leading cause of premature death globally? The factors that put an individual at risk for developing some kind of cardiovascular disease are hypertension, high cholesterol, diabetes, and obesity. Your health behaviors can contribute to the risk of developing heart disease. They include stress, alcohol consumption, smoking, poor diet, and insufficient physical activity. What can you do right now? Healthier habits and avoiding risky behaviors can significantly improve your chances of preventing the onset of a cardiovascular disease. Elevated blood pressure, diabetes, poor diet, and a sedentary lifestyle are all controllable risk factors. It's estimated that 80% of cardiovascular diseases, including heart disease, are preventable. Changing your lifestyle can reduce your risk of developing the disease.
Heart disease typically occurs more often with low-income people and people of color. Families with low income have a significant increase in 10-year risk of atherosclerotic cardiovascular disease compared to families with high incomes as seen in the graph. Additionally, there is a disparity between race and sex. Black, white, and Native Hawaiian groups hold the highest death rates of heart disease at 20 to 21%, as well as the majority of men holding a higher percentage than women. Black and Hispanic groups are more likely to have obesity and diabetes, which are risk factors for heart disease.
Due to the magnitude of heart disease in America, there are several interventions at the federal, state, and local level to combat this issue. These programs work to reduce the risk factors mentioned previously. The CDC provides funding to state programs like the CDPH, which aim to bolster healthy behaviors in communities as well as prevent, diagnose, and manage the disease. Additionally, in San Diego, hospitals incorporate risk assessment and screening for heart disease along with classes to promote wellness. These measures are a step in the right direction, but more efforts are needed in combating rising tobacco use among adolescents, providing accessibility to affordable and nutritious food, and reducing the cost of relevant medication.
As college students, it's important that we know the risk factors associated with heart disease and how to find information on it. Speaking with your physician is the best way to get information that is credible, as well as using the internet for general knowledge. There are many misconceptions from society about the severity of heart disease. One is that as you age, having a higher blood pressure is normal. Although it is true that blood pressure rises with age, this is due to the artery wall stiffening up and causing the heart to pump harder. It is not a good sign, as an overworked heart can lead to a heart attack. Another misconception is that you should take things easy if you're dealing with heart disease. Inactivity can cause clotting of the blood. Rather, physical activity is encouraged, as being active will strengthen your heart and improve blood circulation throughout the body.